A distal biceps rupture is a painful elbow injury among athletic people in their 30s and 40s, as well as older patients. In this video, I'll discuss how a distal biceps rupture occurs, when it needs surgery, and what recovery entails. My name's Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I hope you feel, look, and perform your best regardless of age or injury. The distal biceps, so everybody sort of knows what the biceps is. That's the big muscle in the front. I don't know, you can see it there, the front of your arm. You see it there. But the biceps rupture is a rupture of the tendon as it runs across the front of your elbow down to your forearm. If you look at this model, this would be the humerus. This is the radius and the ulna of the forearm. Let me turn that there. That little stump of tendon is where the biceps muscle, it forms a tendon that runs across the front of the elbow and attaches to the radius. It's what helps pull the forearm up to the shoulder, basically flexing the elbow. The biceps is also important in what we call supination, so turning your forearm over. Now, this is typically an injury where your arm gets basically fully extended very suddenly. What you'll hear a lot of times is somebody is holding something really heavy. The last one I saw, somebody was carrying a couch and then the other person dropped their end. So their end basically jerked their arm straight down, the weight of that couch, and just ruptured that tendon. Typically, this is men in their late 40s or 50s. You will see it in high level athletes in their 30s as they basically get older. The conspiracy theorists out there say that you're more likely to get it if you're on steroids, implicating older professional athletes. I don't know that that necessarily is true, but it definitely is something that can occur in high-level athletes in their 30s, and even people that just like to lift weights and do real physical things in their 30s, 40s, and 50s. Now, as you get older, 60s and 70s, it can rupture as well with probably a less severe injury. In younger people, and I would say 50s on down, maybe early 60s on down, that's something that really most orthopedic surgeons and orthopedic sports medicine specialists are going to fix surgically, basically to reattach that tendon to the radius in the forearm. That surgery typically, or that injury typically doesn't heal well without surgery because that whole tendon is pulled off the bone and it retracts up the arm. So it doesn't typically do well, even with regenerative treatments. I know a lot of people will ask me about peptides or things like stem cells or exosomes. And I can't imagine that that would be all that helpful trying to get an injury, a distal biceps tendon rupture, to heal without surgery. And what will happen if you try to treat that without surgery, this isn't such a big deal as you get into your 70s and 80s, but in younger people, you'll get what's called a Popeye deformity, where you'll get a big bulge as that tendon retracts and the muscle sort of bulges up in the forearm. Typically, you don't actually lose a lot of strength with bicep curls, basically resisted elbow flexion. Where you really struggle is that supination, turning the forearm so that your hand is up, using a screwdriver, turning doorknobs, things like that, because the biceps is really the main muscle that does that. So you're usually okay with elbow flexion, but when you go to do those supination type activities, it can be really tricky. The surgery is typically very successful. There's a theoretical risk of some nerve injuries that, in my experience, is fairly rare, but something to know about. You have to do a lot of work with therapy to get the motion back, because you have to protect that repair for a little bit, but then start to get the elbow motion back and then start to get the strength back. Getting back to the regenerative treatments so many people ask me about, that's where maybe the regenerative treatments might have a role, is to augment the surgery to speed up recovery. Again, I'm not promoting that. Peptides and exosomes and stem cells and things like that are considered experimental. But if there is a role, in this case for peptides, maybe helping to get the muscle strength back, to help that repair become more solid and heal more quickly and get back to normal more quickly, there might be a role there. That'd be something to talk to your doctor about. I'm not endorsing it. I'm just, because I get so many people that ask me about it, that might be the place that it could have a role, but can do very well. That injury can do very well with surgery, but it is a fairly long recovery. Just so you know, when you're talking about even getting back to daily activities, especially in those first 3 or 4 weeks where you can't really use your elbow and can't really use your arm, it can be a tricky problem. Now, I'd love to hear about your experience, whether it's a distal biceps tendon rupture or some other elbow injury. Leave those in the comments below. Just know if you leave a question that is basically asking for medical advice, I can't offer you medical advice there. So what I do is I try to address that topic in a future video. Make sure to subscribe to this channel. Click the bell to be notified when I release a new video or start a new live stream, including my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.